back in the clinic today, and I had a little bit of free time in between patients once again, so I thought today I would discuss with you guys medical grade PRP. It's definitely a treatment that I'm very, very passionate about because it's changed my skin immensely over the years. And it's also become super popular nowadays on social media. And I think, or just generally, not just social media, it's become a very popular treatment. And I think it's because it is more of an organic treatment, an organic alternative to patients who still want to rejuvenate and keep that youthful glow in their skin, but don't want to use fillers and Botox. So they supplement it with PRP, and they use it either with microneedling and PRP or just injecting the PRP into their skin. But either way, it's definitely a more organic route. So I'm going to talk about a little bit about what PRP is and how it works. So PRP is basically platelet rich plasma, and it is just your own blood with a high concentration or a higher concentration than normal of platelets. And it contains growth factors. It contains 7 growth factors. I specifically say 7 growth factors just because a lot of our patients tend to confuse stem cell therapy with PRP. Stem cell therapy has, I believe, about 80 to 100 growth factors. PRP has 7. Cocktail of PRP also has collagen, fibrin, elastin, platelets, stem cells. And in these platelets, we have the growth factors that act as fertilizer in our skin or for our skin. So how does PRP work? PRP basically stimulates cell proliferation and tissue regeneration to dramatically accelerate the healing process. The healing process that we need because we have created micro tears with either a microneedling pen or just injecting the PRP into our skin. So what happens is we basically use PRP therapy basically uses our own natural platelets to produce more collagen. And in return, you're going to create tighter skin, smoother skin, and skin that's just more toned. PRP therapy is used for so many different reasons. Number one reason I get is just overall skin rejuvenation, okay? Number 2, it's for acne scars, hyperpigmentation, stretch marks. It definitely helps with pore size, tightening of pores, but it's temporary. And it just overall gives the skin a youthful, amazing glow. Again, it's changed my skin dramatically over the years. I also kind of want to use this platform to kind of, I want to say, kibosh some rumors about microneedling. I have met so many people that have had the treatment done by estheticians, by girls that work at the front desk of a clinic, and by medical assistants. So there's 2 main reasons why you don't ever want to do that. Number 1, in the state of California, the only licensed professionals that are allowed to perform the procedure are RNs, NPs, PAs, and doctors, MDs. So by law, the other people should not be performing the procedure, right? And 2, you want to avoid any complications. You guys want to keep in mind that the procedure involves breaking skin barrier, and that can lead to infections. So you definitely want to go to somebody that knows what they're doing, that they're legally allowed to do it, they're trained professionally to do it. So that's just something you want to keep in mind. Also, there's just so many rumors price-wise because I work in this field. I mean, there's so many things that are here that are super crazy. I hear doctors that are performing the procedure for $4,000 or $5,000 a treatment, and it kind of just makes me wonder, like, what is it that you're using that's any different from anyone else, you know, that you're charging that price? So don't be fooled. A lot of it is just because of all the hype on social media and the influencers that are going to these doctors. So it's not much different from anybody else. But then the other aspect of it is like the super low prices. You can get the treatment done for like $200, and that kind of creeps me out even more because then I'm thinking, what are you injecting into the patient's face? I personally pride myself in this treatment just because I have done extensive trainings, research. I have years of experience in the treatment. I have personally created my own proprietary treatment plan that delivers noticeable results with a pre and a post care. I firmly believe that this treatment needs a proper pre and post care plan in order to get amazing results. And just also what matters is, and I know for patients this is really hard to know, because you don't go in the back office of a clinic and be like, hey, what centrifuge are you using? Or how exactly are you drawing up my PRP? Because I have seen some PRP drawn up and really what they're drawing up is plasma. So are they really harvesting the platelets? Do you really have the correct concentration of platelets? I mean, I absolutely love the centrifuge that we use at this clinic, just because, so a normal centrifuge spins your blood and you get about my battery's low. You get about 1.5 to 2 times the baseline of PRP rather than regular plasma, right, without spinning it. So our centrifuge gives 4.5 to 5 times that ratio, which is phenomenal. I mean, the liquid gold that we're using is just concentrated with platelets, and your results are just going to be on steroids. So with all that being said, it's definitely an amazing treatment. It's one that I love. It's, again, one that I pride myself in, and go to the right person. Just know what you're doing. Do your research. Results, in my opinion, are phenomenal. I literally have not had a single patient say they don't see results from the treatment. And again, multiple treatments are needed for proper results. That's about it. So if you guys have any questions, you can go ahead and ask them below. I believe that's how it works. This is my 3rd IGTV that I'm posting, and I still don't know if it's like DM'd or questions below. But yeah, go ahead and ask. I have to get going now. I have about 5 minutes until my next patient arrives. So it was nice talking to you guys. Bye.